welcome to Milford Regional Medical Center. I'm Donna Boynton from the marketing department. I believe I spoke with many of you over the phone. So tonight we have here with us Ryan Davia and Amanda Keefe, and they're going to talk to you about a technique called dry needling to help you manage pain. They're going to talk about what dry needling is, the conditions it might treat, whether or not it may be helpful to you. If you do have any questions, we ask that you hold them to the end, and they're happy to take any questions that you have. And you'll also notice that we're videotaping tonight's program, so in a couple of weeks it'll be on our website for you to review if you'd like, or to share with a friend who might not be able to be here tonight. So, Amanda and Ryan.
Thank you. So thank you all for coming to the lecture. We're very eager to share our knowledge about dry needling with you and hopefully help you lead a more pain-free life. So I just wanted to go over what we're going to talk about in the lecture. So we're going to do a brief introduction, and then we're going to talk about what physical therapy is in case some of you are unaware of what a physical therapist does. We're going to talk about pain and how your body interprets pain. Then we're going to go over some dry needling information about the history, the benefits, how your body reacts to dry needling, and then we're going to review who it's appropriate for. After that, we're going to share some current research supporting the benefit of dry needling on various body parts. And all of you have some information sheets that you can take home with you and some business cards, and then at the end we'll do some questions. So hello, I'm Amanda, Dr. Amanda Keefe. I've been working in outpatient physical therapy for over 12 years. I graduated from Springfield College in Massachusetts with my Master's of Science in Physical Therapy, and I graduated in 2007. After that, I started working in a privately owned outpatient clinic, and that was in Walpole and Westwood, Massachusetts. I was there for over 10 years, and in 2016, I started working at Milford Regional Medical Center. I actually work in the Milford office, which is right down the road here on 140. And in January, I will have been there for 3 years. I specialize in dry needling, and I also specialize in dance medicine rehabilitation, which is a type of rehab that's geared for dancers, gymnasts, and cheerleaders. I love treating patients of all ages, little kids to, I think one of my patients is 97, so all ages come to us. And I like treating patients with orthopedic injuries, neuromuscular conditions, patients with Down syndrome or post-stroke to arthritis and sports injuries.
All right. Hi, everyone. My name is Dr. Ryan Davia. I graduated from Sacred Heart University in 2016 with my doctorate of physical therapy. After graduation, I worked at a private outpatient clinic in Rhode Island and came to Milford Regional last October. Like Amanda, I also have a clinical interest in treating a wide variety of patients, whether it's general orthopedics, sports medicine, and also chronic and post-surgical conditions. I have had the opportunity to work with high school, collegiate, and professional athletes, as well as many individuals who are weekend warriors or people who just want to live a better life. So now that you know a little bit more about us, I want to talk a little bit about what we do. So what is a physical therapist? So physical therapy is a healthcare specialty that includes the evaluation, assessment, and treatment of individuals with limitations in functional mobility. Physical therapy is designed to help patients develop, maintain, or restore maximum movement throughout their life. So regardless of what threatens your mobility, whatever is causing you pain, a physical therapist will be able to help you with that. So physical therapists have undergone anywhere from 6 to 8 years of higher education, and at this time the standard is that colleges and universities will grant a doctorate of physical therapy degree in order to allow someone to practice in their state of choice. After that, we must pass a board licensure exam, and in Massachusetts we're licensed through the Board of Allied Health, and we have to maintain a current license in order to practice legally. We have extensive knowledge in anatomy, physiology, and neuromusculoskeletal conditions. So at Milford Regional, we offer services at 3 different locations, one in Milford, where both Amanda and I work. We have one in Northbridge and one in Franklin, although only the ones in Milford and Northbridge are offering dry needling services at this time. So most of the patients who come into our door come in because they're in some sort of pain. So I like to describe what is pain. So pain is a collection of unpleasant sensory, emotional, and cognitive experiences provoked by real or perceived tissue damage. Easier said, pain is your body's way of letting you know if there's danger present or a potential danger. So this can come with any stimulus, whether it be too much pressure, too much temperature, too much stretch, or the presence of chemicals. So pain is a subjective experience. That means that each person will experience something a little bit different with a given stimulus. So one person would be able to, have a little bit of pain with a hot water that's a little bit, warm, and another person would be a little bit more painful in that situation. Interestingly enough, a pain experience can also be altered in an individual regardless of their psychological state and also environmental factors. So you could have a changing state in each person. So you're not destined to live in pain for the rest of your life, is what that's saying. So how do we feel pain? So the body has different receptors that sense these specific stimuli that we talked about. These are located in your skin and other tissues. So whenever a stimulus comes that exceeds a threshold level of what the body perceives as safe, they'll send a signal up to the brain. That signal travels up the spinal cord, where it ends up in the brain. The brain analyzes that information and also takes into account prior experiences. Have you seen this before? Have you felt this before? What happened at that last situation? And it takes all this information into account. And if at that point it still feels like there's a danger to your body, then it will send a pain signal down to the region. So I like this picture. It's just a simple little picture about how we feel pain. So on the left-hand side of the picture, you see the foot, and then we see a nice little tract. That's the spinal cord where it's going up towards the brain. I also like this picture because it shows you the different areas of the brain that are involved with pain perception. So on the left, we have the sensory cortex. So that helps us know where and how much of the stimulus there is. We have the frontal cortex, and this area is what assigns meaning to the pain. So I talked earlier about how your brain analyzes past experiences in similar situations. That's where this takes place. And then another system that's heavily involved is the limbic system, and that assigns an emotional response to the pain.
So let's get to the reason why you're all here tonight, to learn about what dry needling is and how it can help you. So dry needling dates back to the 1940s. Dr. Janet Travell used wet needling to identify muscular trigger points that were able to elicit referral pain patterns. She later discovered that dry needling was able to offer the same results. Her work was innovative, and she was the one that created the term dry needling. Dr. Travell, along with her colleague, Dr. David Simon, were able to identify the trigger points in the human body and establish the first generation of modern dry needling. Since the early 1980s, dry needling has been utilized in Canada, Chile, Ireland, Spain, South Africa, and the United Kingdom, and it was first performed in the United States in 1984. So most people are familiar with wet needling, and that's when a substance, usually a medication, is introduced in the body through a needle. An example of this would be a cortisone injection. I know a lot of people come to physical therapy after they've had a cortisone injection or they have one for arthritis in their knee. But dry needling doesn't involve any sort of medication. It does use a needle, but nothing's being entered into your body. So the American Physical Therapy Association defines dry needling as a skilled intervention used by a physical therapist that uses a thin monofilament needle to penetrate the skin and stimulate underlying myofascial trigger points, muscular and connective tissues for the management of neuromuscular pain and movement impairments. So if anybody has been to physical therapy before, your physical therapist might use different modalities or tools during your treatment. In addition to corrective exercise, they might use ultrasound or laser, Graston technique, or a TENS unit for pain. And dry needling is actually another tool that we use as part of your overall physical therapy plan of care. So when talking about dry needling, there are actually several other names that clinicians will use to describe the same technique. So it's important to understand those in case you hear somebody talking about them. So some of the names that people might use to describe it are trigger point dry needling, intramuscular stimulation, intramuscular manual therapy, functional dry needling, and there may be others too. So in the United States, the practitioners that can use dry needling are physical therapists, chiropractors, physicians, naturopaths, and acupuncturists. So musculoskeletal disease affects 50% of people in the United States that are older than 18 and almost 75% of people over the age of 65. So that's a lot of people. They're very prevalent, and patients are usually seeking medical treatment from physicians and physical therapists with knowledge of different modalities, including dry needling. And they do this to help improve their function and reduce their pain. So the goal of physical dry needling is to desensitize hypersensitive structures to restore your motion and function and to allow the body to induce a healing effect to the tissue. Dry needling is typically used to treat muscles, ligaments, tendons, fascia, scar tissue, peripheral nerves, and neurovascular bundles for the management of a variety of pain syndromes. And it can also bring blood flow to an area to aid in healing. A dry needling therapist can also use the needle as a diagnostic instrument, and we can actually feel the different layers of tissue when we're using the needle, so we can tell where you're tight in certain areas. And sometimes we'll use stimulation of the needles, which is either manually or on a low frequency electrical stimulation, and it helps to stimulate the smooth muscle fibers to increase blood flow, which helps specific muscles or areas of inflammation heal faster. So Ryan discussed how we feel and interpret pain. Now I'm going to go over how our bodies react to the dry needling. So the dry needling acts locally, segmentally, and systematically on the body. When a needle penetrates the skin, the body releases chemicals which in turn cause vasodilation, increased blood vessel formation, and increased tissue repair. Segmentally, which happens at the spinal level, a chemical release occurs which regulates nociception and results in a local pain response. The systematic response occurs as a result from the brain creating an analgesic effect which reduces the pain. The exact mechanisms of dry needling are complex and aren't fully understood, but the effectiveness lies in the distribution of the dysfunctional nerve end plates. And there's a growing body of scientific evidence that supports the positive effect inserting a needle has on the electrical and chemical communications that take place in our nervous system. These include inhibiting or blocking the transmission of pain signals in our spinal cord, and it allows your body to release its own pain-relieving chemicals in your brain. It has also been shown that deep stimulation has better pain-relieving effects when compared with superficial stimulation, which basically means that the depth of the needle is actually important for relief of muscle pain. So we get a lot of questions about what the difference is between dry needling and acupuncture. And really the only similarity is that they use the same type of monofilament needle. They're very thin needles, and acupuncture is a practice that is based on traditional Chinese medicine. Practitioners use the needles at predetermined points in the body along meridians or lines on your body. The goal of these treatments is to restore the body's balance or the body's qi or energy flow. The body's qi should be free-flowing, and when it becomes blocked, that's when they feel there's dysfunction or pain, and it can alter your state of a person's qi and cause a multitude of ill health effects that might be orthopedic conditions, but they could also be digestive issues, addiction, or pain. And some ways that an acupuncturist might determine where to place the needles might be looking at the color of your face and tongue and the speed and pattern of your pulse. So dry needling is very different. It's a concept that's based in Western medicine. While dry needling does use the same monofilament needle, as I mentioned before, that's really where the similarities end. A practitioner performing dry needle will use their palpation skills and their knowledge of anatomy. We identify tight areas of muscle or connective tissue that may be contributing to your pain or your movement dysfunction, and then we place the needle under the skin using one or multiple techniques that Ryan's actually going to describe.
All right, so talking about the dry needling techniques, we have two main techniques. So the first one is a dynamic technique. So this is where the needle is placed into the skin and then slow rhythmic movements in and out of the tissues are performed. So we find a trigger point, an area of restriction, we'll palpate that, and then we'll go in with the needle and perform slow rhythmic motions in and out in kind of a pistoning fashion. And we'll do that until we get that local twitch response that we talked about. The second main technique is called a static technique. So this is where the needles are placed into the skin and the other tissues and left in place for a period of time. So the static techniques can be augmented, as Amanda was saying, with the electrical stimulation. So this would bring increased blood flow and further reduce muscle tension as compared to the static technique alone. So here's what everyone's been waiting for. What conditions will this help you with? So as you can see here, there's a wide variety of conditions that dry needling can help. The APTA says that which is the American Physical Therapy Association, the governing body of physical therapy in the country, says that dry needling may be incorporated into any treatment program where myofascial trigger points can cause pain or movement impairments. So later in this presentation, we're going to go into the research and break it down by body area and look at what they found when they were examining dry needling treatment. But these are some indications, some conditions that could be benefited from dry needling treatment. So as with any medical procedure, dry needling isn't for everyone. So up here we have a list of both contraindications and precautions. So the list on the left is a list of conditions or situations where a person would not be appropriate for dry needling. They range from everything from a needle phobia, and why you go getting dry needling if you're afraid of needles, or other things, that systemic issues or bleeding issues that we have to worry about. So the list on the right is just a caution sign. It's precautions. Dry needling can still be performed. We just might need be a little more careful, and maybe get a little bit more background. But your physical therapist will be able to help you identify if any of these situations is present in your particular case, and will be able to best guide you to a safe and effective treatment plan.
So what does dry needling feel like? Typically, patients will feel a mild pain, but it doesn't last. When the needle does enter your body, there's a slight pinch, and it's very similar to a finger prick, like when you're giving blood when you're a kid. When the needle's in, you may not even feel it, but sometimes there's a general achiness that's felt. This sensation is actually desirable because we know that the needle is able to stimulate the nerve and the muscles that are tight and causing you pain. There may be some soreness right after the treatment, but this is normal, but it doesn't always occur. Sometimes patients feel fine and they are able to go right back to their normal activity. Sometimes the soreness is delayed for maybe a couple hours or even the next day, and the soreness also might depend on the area of the body that was treated, as well as varies from person to person. Typically, it will feel like you just had a workout at the gym and your muscles are sore and maybe fatigued a little bit. Occasionally, patients might have a little bit of bruising with the soreness. Again, it is normal. It doesn't always happen though, but it's something that we like to let our patients know about. During the treatment, you're actually very common to feel very relaxed, and you might feel tired during the treatment, and that's actually kind of a nice side effect of the treatment because patients are usually coming in, they might be stressed and just thinking about their pain all the time. So we get them down on the table, they have the needles in, they just feel really good, relaxed, tired.
Nice little side effect,
yeah. So after the treatment, you might feel soreness, as with any manual technique. Sometimes that happens after a deep soft tissue massage or something like that. And once the soreness subsides, usually there's an improvement in the initial symptoms that you came for. The soreness can last, usually that night, sometimes the next day, as I mentioned before. And the amount of sessions varies patient to patient. A lot of people will come in, they had one treatment or they're just interested in it and they're wondering, how many sessions do I need to come for physical therapy to get rid of my pain? Some people it's 1 or 2 sessions. Some people it might take 8 or 10. So it's really hard to answer that question. But when you come in and see your physical therapist, we'll decide your plan of care and your treatment plan and decide when it's appropriate, how many times a week, if you need to take a break or just do some exercise. So when you do have some of the pain after the treatment, we might advise you to use some heat or some ice, and this just helps relieve that soreness. You might temporarily need to modify some of your exercise. As with anything, if you're feeling sore, I wouldn't go out and walk a mile. Again, dry needling is only one part of your treatment. Some of the other therapy techniques might be used in combination to gain the best results. And we'll usually always provide you with some corrective exercise that will be progressed over time in addition to the physical therapy plan of care and the dry needling treatments. So is dry needling safe? We go to great lengths to ensure safety. We only use sterile, single-use, disposable needles, and we apply OSHA standards and use high-quality personal protective equipment, such as gloves, with every treatment. We really have a high standard of safety at Milford Regional Medical Center, and dry needling is part of your treatment plan, as I have mentioned a few times, and it's conducted by our therapists, and we've all undergone thousands of hours of training. We've all passed our board exams. We have an understanding of anatomy and physiology and a thorough knowledge of your condition because we did the evaluation and have spoken with you about your past medical history and everything. So this picture to the right are the actual needles that we use. We use the Sarin brand needles, and each one is sterile and individually wrapped. So we never use them again, and after we use them, they go right into the sharps container. So it's very clean and safe.
Currently, dry needling is not an entry-level skill, so that means that DPT programs across the country, most of them aren't teaching it as part of their regular curriculum. So that means that physical therapists or practitioners who want to practice the treatment have to undergo continuing education. So there are a lot of different companies out there that are offering certification programs. While they differ slightly, all of them teach safe needle handling technique and also ways to identify and treat the impairments that you may present with.
So if you're interested in dry needling, you'll need to set up a physical therapy evaluation. And as Ryan mentioned earlier, currently 2 of our clinics offer dry needling, and that would be Milford, where we work, and then the clinic that's in Northbridge. The business card that you have with you has the contact information and the address on there. We do require a physical therapy prescription, so you would need to either call your physician or actually go and visit them. When you do call to get that prescription, you can have them write dry needling right on the prescription. When you call our clinics to make an appointment, you also want to be sure that you mention to the receptionist that you're interested in the dry needling and you want to be evaluated to see if it's appropriate for you as part of your physical therapy plan of care, because not all the therapists are certified in dry needling. At Milford, we have 3 therapists that are certified in dry needling, and in Northbridge, there are 2. So you just want to make sure that you're getting an evaluation with the right person. So when you are seen by a physical therapist, we will do a thorough evaluation and determine your diagnosis and see if you have any movement impairments that might be contributing to your symptoms. The physical therapist will use their palpation skills, and we will assess your soft tissue restrictions and see if they are able to elicit any of your pain and symptoms. You will work with your physical therapist together to develop an individualized plan of care that might include exercise, manual techniques, dry needling, or other modalities as well that will help your signs and symptoms.
So as promised earlier, we're going to look at some of the research regarding dry needle treatment in specific conditions in different body areas. So the first area that we're going to focus on are chronic pain and fibromyalgia. So chronic pain is a hot topic right now and affects nearly 50 million adults, according to a National Institute of Health study that was completed in 2012. This has been one of the more studied conditions when it comes to dry needling treatments, and there's a good amount of research out there. One such study by Sanchez et al. Took 64 patients who were diagnosed with fibromyalgia and compared dry needling treatment to other myofascial techniques like massage. Dry needling led to improved outcomes and reduced anxiety and limitations from pain. These people felt more empowered, and they were less likely to let the pain drive their lifestyle after the dry needling treatment than with the manual myofascial techniques alone. So another study regarding chronic pain and fibromyalgia was by Gerber et al., and they studied the effects of dry needling on myofascial trigger points and pain. So all of the subjects had pain for greater than 3 months. So that's a nice little time frame for letting us know that it's a chronic condition. So they found that dry needling led to improvements in validated outcome measures that examined pain, mood, and their perception of quality of life. So based off of the current research regarding chronic pain and fibromyalgia, dry needling may be an effective option for chronic pain conditions. So oftentimes after a stroke, individuals have increased stiffness in the muscles that were affected. This is called spasticity. Traditional treatments for spasticity include stretching and flexibility exercises in addition to injections of Botox or other agents. Sanchez-Mila et al. Looked at the effects of dry needling on spasticity following a stroke. They found that the addition of dry needling therapy to a traditional treatment program led to further improvements in the spasticity of the patients that were studied compared to the traditional therapy alone. So who hasn't had a headache before? Everyone has. So headaches affect people of all ages, and while there are many types of headaches, one of the most common are tension-type headaches. So these can be increased by stress and can lead to increased muscle tension, and we often find myofascial trigger points present. So that's why the study by France et al. Was pretty cool, because they did a lit review on the research and found that there were statistically significant improvements from dry needling therapy in those who were suffering from tension-type headaches. So they looked at the research, they searched the databases, and they kind of took all the information together and found that it was an effective treatment for this specific type of headache. Another condition that has been studied with dry needling is TMJ, or temporomandibular joint pain. And so as with headaches, there are many causes for TMJ, so it might not be appropriate in each specific case, but many times one can find myofascial trigger points in one of the many muscles that are involved in chewing, opening your mouth, talking, all that fun stuff. So Osden et al. Looked at dry needling for patients with myofascial trigger points that were located in the masseter muscle. So the masseter muscle is located right on your jaw here. And they noted that following dry needling, there were significant improvements in many parameters, including jaw opening and also pain pressure threshold, which means that the patient was able to withstand a greater amount of pressure before that sensation of pressure turned into pain.
All right, so neck and shoulder pain is very common. Upper quadrant pain, which includes conditions in the neck, shoulder, elbow, and wrist, account for high healthcare costs. The shoulder pain is the third most common musculoskeletal condition with a prevalence of 70%. Factors that contribute to shoulder impingement are poor postural awareness, rotator cuff weakness or inflammation of the tendons, and posterior capsular tightness, which can lead to an abnormal position of the shoulder joint. A physical therapist can effectively diagnose shoulder impingement with a thorough evaluation and don't need to use any diagnostic imaging such as MRIs or X-rays. So this looked at a recent 2018 study on the effectiveness of dry needling in pain and function on shoulder impingement. In the study, there were 50 subjects who were diagnosed with shoulder impingement, and they used several outcome measurement tools to compare pain and disability, and range of motion measurements were taken for each of the patients that were included in the study. Both the control and the experimental groups received conventional physical therapy treatments with a home exercise program, and the experimental group had an addition of the dry needling treatments. So the results that they found were that both groups were effective in pain reduction, improving disability, and increasing range of motion, but the dry needling group was more effective and were able to see greater improvements overall. So here's another study, and this was actually a systematic review, which was a review of 5 different research studies. and they all looked at the effect of dry needling for myofascial trigger points in the neck and the shoulders. They were comparing dry needling to a lidocaine injection, which is administered by a physician. And the results found that both the dry needling and the lidocaine were able to reduce the pain. However, dry needling provided a more favorable treatment option because it's less invasive, has lower costs, and it also has less adverse effects compared with a local joint injection. So now we're going to talk about lateral epicondylitis, which is also known as tennis elbow. And it's a very common condition. It's most prevalent in middle-aged people, and it can decrease your productivity and result in economic loss. Some of the symptoms that are consistent with lateral epicondylitis are pain on the outside of the elbow that's exacerbated by repetitive wrist movements. And this is usually during tennis, or it can also be during computer work at the computer because you're using your wrist a lot. Often the first line of treatment in this type of condition is a combination of exercise, manual techniques, anti-inflammatories, and wrist immobilization or a wrist splint. So this research study looked at the effectiveness of dry needling as a first-line treatment to improve the symptoms of pain. There were 92 subjects that had elbow pain, and they were included in the study, and half of them received dry needling treatments. The results of the study found that both groups benefited from their treatments, but the dry needling group had a significantly better improvement in pain and function scores compared to the other group. So low back pain. So many people have low back pain. It's actually the most common reason that people go visit their physicians or go to the emergency room, and it can affect as many as 85% of people in their entire lifetime. A lot of time it's a chronic condition and will reoccur over time. So the management of low back pain can comprise of a variety of interventions. It can include invasive surgery, to exercises, to acupuncture and dry needling, physical therapy, visiting a chiropractor, massage, and oral medications. Dry needling has become more popular recently because it's a good treatment that has good efficacy and it's very simple to administer. So this study was a systematic review, and it was looking at 11 different randomized controlled trials. So that's 11 separate research studies, and they basically summarized what they found. There were 802 patients that had low back pain, and they used dry needling to manage this pain. The results showed that dry needling of myofascial trigger points was more effective in relieving the intensity of the low back pain. And the authors of this study also suggested that dry needling should be used in addition to other treatments in physical therapy because it's better than just having the dry needling by itself. So greater trochanteric pain syndrome is pain or tenderness on the outside of the hip, and it affects 10 to 25% of people that come with hip pain. The condition was previously called greater trochanteric hip bursitis, or more commonly just people would call it hip bursitis. And it was thought that it was a swollen bursa that was causing the pain. And due to this, corticosteroid injections were used to help decrease the pain and swelling. New research has actually led healthcare providers to the conclusion that there's actual injury to the tissue and tendons and muscle around the hip, and that's the real cause of this type of pain. So the goal of this study was to determine whether dry needling was as helpful as a cortisone injection for patients with this type of pain. There were 43 participants who were randomly assigned to either a dry needling group or a cortisone injection group. And after 6 weeks, they were able to show that the injections did not provide any greater pain relief or improvement in function than the dry needling group. So again, it kind of brings it back to that dry needling is less invasive and it's able to offer an alternative treatment to an injection in this type of patient. So plantar fasciitis is the most common cause of heel pain, and it affects 1 out of every 10 people. I actually suffer from this myself and have found dry needling to be very helpful. It is a self-limiting condition, and it can take months to even years to recover from. It is thought that myofascial trigger points within the plantar foot muscles play an important role in the pain. Steroid injections can be effective in short term, but they can also have adverse reactions such as plantar fascia rupture. So dry needling is less invasive and it has minimal adverse reactions. In 2017, there was a meta-analysis was published on the effectiveness of dry needling on plantar fasciitis. And they looked at 7 randomized control trials that were published from 2011 to 2017. The results were able to show that myofascial trigger point dry needling significantly was able to reduce the heel pain and on the visual analog scale, which is a scale that we use. You're probably familiar with it. It's that scale that people will ask you, what's your pain from 0 to 10? So they were able to show that dry needling was able to significantly lower their pain number rating. All right, so we talked about the information sheets. You have them in your hands. If you have questions, most of what we talked about in the whole lecture is mostly in the handout. And the business cards are also in your hands, and they have the phone numbers and contact information for the 3 clinics. Again, we just want to reiterate that it's only Milford and Northbridge that do offer dry needling if you are interested in making an appointment. So at this time, if anybody has any questions, we will be happy to answer anything that you would like to know. She was asking if we can comment on medial epicondylitis, which is also referred to golfer's elbow. Very similar treatment kind of stuff as lateral epicondylitis, and yes, it's very helpful in that. It can help reduce some of those tightness in the extensor or flexor muscles in the area. So yes, we can do dry needling in that area too.
Yeah. So for right now, the physical therapy evaluation, if it is medically necessary, is covered by insurance. But and the other treatments, the manual interventions, and the exercise that goes along with the physical therapy treatment plan are all covered, and the dry needling will be performed under that.
Sure. So she asked if we could comment on scoliosis, which, if you're unaware of what scoliosis is, it's a back condition where your spine might have a curve to it. A lot of times you can have pain with this type of condition, and very similar to back pain. Yes, we can work with scoliosis. A lot of times with that, we like to see an x-ray just to see how your curve is, because your anatomy would be a little bit different than a standard low back without a curve. But absolutely, your muscles will be tight on certain areas, and the dry needling can help loosen that and relieve some of your pain. So her question was, what was the first thing that we should do if you want to come see us for dry needling? So the first thing that you would want to do would be to call your physician. It could be your primary care, or if you have an orthopedic doctor, you want to call them and let them know that you're having pain and you're interested in going to physical therapy for dry needling. You definitely want to mention that you want to come to physical therapy, because that's who we are and that's what you're coming for. So you definitely want to call them first. Then you would want to call us to make an appointment.
There has been some research out there for it being effective with migraines. Yes. Nope. Anytime there's some of the muscles underneath the skull, the suboccipital muscles, they can be really tight in people with migraines. There's also, we've seen that there's a lot of tightness in the neck with people who have chronic migraines. So the dry needling can go to help with that as well, for sure.
So she asked how effective it is for spinal stenosis. So spinal stenosis, if you don't know what that is, it's usually happens when you're older. It's when the spinal canal kind of closes a little bit. A lot of times with that type of condition, you have tightness in your lower back and pain. And again, we're targeting those muscles in that area, so you can definitely have dry needling treatments with spinal stenosis.
Yeah, so the dry needling wouldn't fix the stenosis, but it can help with some of the other the things that pop up as a result of the condition.
So his question is, does Medicare cover dry needling? So dry needling is one part of physical therapy. Medicare and basically most insurances will cover physical therapy. So that's what you're coming for. You're coming to us for physical therapy. We're using a modality, dry needling to help you in your recovery. We won't be just using that. We'll be using manual techniques, doing therapeutic exercise, helping you improve your function by doing stair training or gait training. So it's all part of physical therapy. So yes. So the question was, do we do one side at a time or can we do both sides at the same time? So that kind of would depend on the patient. If you're coming and your prescription is for lower back pain on both sides, then usually I would do both sides, but it's kind of an individualized plan. If you have bilateral knee pain, possibly we would do both sides at the same time. So because we're evaluating a specific body part, we wouldn't be doing like your whole body at the same time or multiple sites. For physical therapy, we would do an evaluation on your neck. We would treat your neck. We might do the dry needling on your neck. And then you'd probably have to do a separate, like once that's finished, we'd do a separate evaluation on your lower back. It's difficult to treat more than one site or body area at once just because it's a lot of, we do a lot of stuff. We do a lot of exercise. We do some manual work. We might do the dry needling. We might use ultrasound or laser. So the question was, if anyone didn't hear, does dry needling help with arthritis? Yes, it's very effective, actually.
Great benefits.
Really good benefits. It does not help cure your arthritis. It cannot do that. That's something that your joint is degenerative in that area. But what the dry needling does is when you have a chronic pain, Ryan mentioned kind of that pain cycle where you're continually getting that signal to your brain about the pain. It helps to kind of break that cycle. But again, you want to do that in addition to corrective exercise because strengthening the muscles in the area also helps to reduce pain.
Yep. So the question was, if you already have a script for physical therapy, do you have to go back to your doctor now to add dry needling to that? And the answer is no. If you come to us for a physical therapy evaluation and your physical therapist identifies dry needling as possibly beneficial for you, we will send an order form over to the doctor, the referring doctor, and we'll have them sign it if they are on board with the treatment. And then once we have that signed form, then we'll go ahead and do the dry needling.
If you're in physical therapy in a different location, can you come to us for dry needling for physical therapy? Yes, I believe so. It probably depends on your insurance. That would be an insurance question. You might have to kind of look, but you could always call and we have great front desk people and they could look that up for you and let you know. Usually, yes, I've had patients come from other clinics before and they've had physical therapy somewhere else and they wanted to do the dry needling and it was covered. So the question was, is the trigger point where you're actually feeling the pain or can it be referred? Or is it referred?
Yes.
So it can be referred. You can have pain right in a specific tight area where there's a trigger point. But a lot of times when you have pain, say, say down your arm here, we might feel up here and that reproduces your pain right there. So that's where the pain is most likely coming from. A lot of times if it's following a nerve pathway, we might dry needle the source of where we're feeling the tightness and also along the nerve too.
So they're a little bit different, but yes, they do tend to be tender or sore. You might feel them as kind of knots. People have talked to them, have described them as. But trigger points can be kind of separated into two groups, or active and latent. So active means they're painful. All right, they're painful spots, and we don't have to do anything to them for them to be painful. Latent trigger points, we need to press on them or kind of stimulate them a little bit for them to cause pain. And both types of trigger points can cause pain at the site or referred. So again, that's why it's important to get a full evaluation in order to identify where the source of the pain is.
So her question was, is this something that you're going to have to continue your whole life? How long does dry needling effects last? Again, that's kind of varies person to person. Like we mentioned before, you might have 1 or 2 sessions and then you don't have pain again for years. It might take more than that. It depends on also if it's a really chronic condition, then obviously you might have a little bit of pain. If you have arthritis in your knee, you might always feel a little bit of pain until you maybe do the joint replacement or something like that. But it has good benefits where the pain can, be minimal for a while or never come back. So
Yeah, it's all
individualized.
individual. Yeah,
Yeah.
it's all individual, and we can see that. I like to think of dry needling as a reset technique. So we'll use the dry needling to kind of create a blank slate or work towards that. And then the exercises that will be also included in your program are kind of there to solidify everything and kind of keep it to stick, make it stick.
So her question was, if you're in the clinic that does not offer dry needling, can you come to one of the other clinics? The physical therapist can send you over. At Milford Regional Medical Center, we do like a doctor to sign off on it, but since you're already in physical therapy, you can come to one of the clinics that does offer it, and we can be the one that sends that to your physician, and then they can decide if they agree with us that it would help you. So his question is, how many sessions would it take to figure out if the dry needling would help at all? Again, that's very individualized. Usually, if we're not seeing any benefit from the dry needling after several sessions, we probably wouldn't continue it because it may not be effective for you. Maybe something else would be more effective for you. Maybe just doing the corrective exercise, or maybe a different type of manual technique or modality. As with physical therapy, we wouldn't continue to do something that isn't helpful for you. We would either send you back to the doctor or try something different. We like to try everything before we send you back somewhere or decide that it's not going to work. So the question was, if you have dry needling on your lower back, would you need transportation like when you go to a pain clinic and they do an injection? No, you don't need to have any transportation. You should be fine to get up and move around. It doesn't affect your cognition or your ability to drive at all. The only thing might be that you're a little bit sore in the area, but that's something that either heat or ice might help you with. And we usually will always do that at the end of the session so that you're feeling comfortable before you leave. And we'd make sure if for some reason you weren't feeling comfortable, we wouldn't let you go until you are.
So if we have a diagnosis of fibromyalgia, it is a widespread chronic condition. So it affects the entire body. So we that would be treating one condition as opposed to one body part. So that would be one diagnosis. So if someone comes to us with a physical therapy referral for low back pain, then that is the diagnosis. So we have to treat any impairments that are related to the low back. So if you come with a diagnosis of fibromyalgia, we can do whatever we deem necessary in order to make you feel better and regain your function. So sometimes if we get certain areas, other areas tend to clear up a little bit too. So it'll just by clearing up one, we can kind of get some trickle down effect from some other areas. So we might not have to work on as many as you'd think.
So her question was, if you have plantar fasciitis, there's two different kind of treatments that you can incorporate into physical therapy. One's called Graston technique, and the other would be dry needling. Graston technique is a type of manual technique. It uses metal instruments to break up soft tissue or adhesions in tissue. For plantar fasciitis, it would depend on your physical therapist. They would assess where you're tight. A lot of times they might use both. Because there is tightness in that area, we do need to break it up, and Graston is a great tool for that. So they could use the Graston tools, or they could even just use their hands and do some manual techniques. The dry needling can help kind of reset that pain signal that you're getting, and also help to break up some of those, the tightness that's in the plantar fascia.
So again, I like to think of sciatica as more of a symptom as opposed to a diagnosis, but so there's a lot of different causes for sciatica. So again, I think a full physical therapy evaluation would be in order. If again tightness is contributing to your symptoms, then the dry needling may be a benefit for you. All right, so the question was, is the age of the injury a effect or having any effect on the treatment and the amount of degeneration within the area, if there is degeneration? So chronic conditions have had an opportunity to kind of settle down a lot of times. So usually they're a little more difficult to kind of clear up than an acute. You wake up with a stiff neck, you can usually get in there pretty quickly. Chronic conditions have kind of had their time to develop and kind of spread a little bit, so they take a little bit longer to kind of clear up usually. And in terms of the degeneration, well, again, in a joint that has undergone degeneration, it's not going to be functioning at as high a level as one that doesn't. So again, we can treat some of the impairments that are associated with it, but the dry needling doesn't fix the degeneration.
The question was, does dry needling help with inflammation? Absolutely. A lot of times when you have pain, there's inflamed tissue in the area, and dry needling can help reduce that inflammation. It can bring blood flow to the area and help reduce the help improve the healing in the area and reduce the pain. So absolutely. So our question is, if you have chronic migraines, how frequently would we want to see you for dry needling? Again, this is a little bit of an individualized, depends on how you're feeling, how your symptoms are. You might start out in physical therapy. Usually you come 2 to 3 times a week, and we might do dry needling both of the times in the beginning to kind of get your symptoms to flare down. We might just do once a week. It's really hard to say. You'd have to probably make an appointment with one of us or one of our colleagues, and we could better assess you and be able to answer that for you. If you plateau, if your pain level plateaus with therapy, we probably wouldn't continue doing it. If it seems like it helps you and you're able to be symptom free for a couple months, and then you get symptomatic again, it might be something that you'd want to continue, just to maintain your migraines and the tightness in that area. So the question was, how can the dry needling help with scar tissue? So it depends on how old, how long ago the surgery was and how kind of thick the scar tissue is, but it does kind of help to remodel the muscle and the tissue in the area. So it probably would help. It would be tough to say how many sessions and all of that. And I feel like we would need to kind of look at your situation and assess the scar tissue in that area. But dry needling is helpful in scar tissue. So yes. So the question is, about laser in physical therapy and why laser might be done versus dry needling or vice versa. Again, laser is a modality in physical therapy, so maybe both would be used. Maybe only one, maybe both, maybe just the laser. Laser helps bring blood flow into an area and also helps promote healing. So it depends on what you're coming for. If you're very inflamed and it's, you have difficulty moving around, we would probably want to control your pain at first. So that might be something that we would do in combination. So the question was about piriformis syndrome, and it's been about 1.5 years, and if it would be helpful for that. Again, a little bit individualized. Personally, I've had patients who've come with hip pain in that area who've had great success with dry needling, and they have been kind of chronic issues. Kind of like what we mentioned before about that chronic type of pain. It's the signal that's being sent repeatedly to your brain that there's pain in that area, and dry needling is able to help decrease the sensitivity in those nerves in that area, and it can also help with the tightness in the muscle. So you'd have to kind of come in and we could kind of assess you, but I've had success with pain in that area of a more chronic nature. So we learned we had our training through different places, and there's different philosophies on the dry needling too. So where I took my course, we a lot of times we'll leave the needles in for up to 20 minutes, and they'll either be manually stimulated to kind of stimulate the nerves in the area and help the muscles relax, or I'll use the electrical stimulation to also help that. So could be up to 30 seconds to 20 minutes. No, we're always talking to each other about patients, techniques. I have this patient, they're tricky. What do you think? So all of us, not even just, the dry needling therapists. And also, I leave my needles in, but I also do the technique where you put it in and out as well. Yep, Ryan does the same thing. Sometimes he'll leave them in a little bit longer and use some electrical stimulation. So just because we did the training and kind of have different philosophies, we do all the different techniques. So we are training, yes. I mean, technically, yes, but we had extensive training on what to avoid, the precautions in the area, because, in your trunk, your lungs are there. obviously that is a lot of other stuff. That is a precaution in the area, but we're well trained to know all of those precautions. We know our anatomy inside and out. We know where things lie, and we are very safe in making sure that we don't do anything that would be unsafe and harm you. So the question is, have there ever been adverse effects or more pain after the treatment? So as we mentioned kind of what the dry needling feels like, sometimes you can be a little bit more sore that night or possibly even the next day. Usually that will go away. And if you are feeling worse, you would obviously let us know, and then we probably wouldn't continue it for you or whoever that would be. Any other questions? We'll probably wrap up.
All right. Well,
All
thank you
right.
for coming, everyone.